My name is Christina Abraham, and I'm a gynecologist, and I assist couples with their infertility treatments after seeing them try for years and do not have any success. My office is located in Carrollton, Texas, which is a suburban area with many families. Chlamydia is a commonly sexually transmitted disease in the U.S., and it is seen in about 1 out of every 20 patients who come in for infertility issues. This disease could cause permanent damage to the fallopian tube, cervix, rectum, or throat, which could progress to infertility. Men could experience this disease in their urethra, rectum, or throat. Many of my patients never end up knowing that they acquired disease because most of the time no symptoms are present. Some of my patients have vaginal discharge, pain during urination, fever, and nausea. However, these symptoms are very rare. I prescribe oral antibiotics to patients for about 2 to 3 weeks depending on the severity. If the patient is experiencing severe pain and the fallopian tubes have been infected, I require the patient to be hospitalized and be given pain medication. I request the patient to come in after 3 months to make sure the infected area has been cleared. A 28-year-old Caucasian woman who is in the lower middle class came in experiencing pain in her stomach and bleeding through her vaginal area not during her menstrual cycle. She had no prior medical issues. The patient was diagnosed with chlamydia and told me her and her husband have been trying for a baby for the past couple of years, but in the past couple of months the symptoms of chlamydia progressed. I had to hospitalize the woman because the infection spread to her fallopian tubes and into the rest of her reproductive system, which was causing the severe pain and it required surgery. I wanted her husband to be tested for STDs, and turns out he also had an STD. Women and men should both be tested for STDs because you never know when you could be infected, and you do not want your symptoms to progress. I would educate them about the importance of using protection. It is essential to test patients for issues like this when patients come in with infertility issues because a root problem could be present, but sometimes it could just be family genetics. The major problems that still need to be solved are couples who have been trying for years should frequently schedule gynecologist exams so they can make sure nothing is physically wrong with either the man or the woman.